So now we get to the outliers. So environmental toxins, mold is a very common one which we see in our practice quite often. If you live in an old house that has water damage, you most likely have black mold in the walls. Now, not everybody reacts to this, so if you can genetically you're able to clear out toxins like black mold or other types of mycotoxins, then you may not have no symptoms at all. However, if you cannot clear it out, then you will get very ill from these toxins. I mentioned heavy metals. Now, heavy metals, lead and mercury, may not necessarily cause fatigue, but they can certainly add to the body burden. And I had a patient who had very high levels of lead and mercury, and his symptoms were episodes of severe depression that would last 2 to 3 days, and then episodes of rage. We treated him, I actually chelated him twice, and he's been very stable. So this can be an issue. It had to do with what he was doing in his job. He was having exposures. Now, has anybody heard of POTS? Does anybody know what POTS is? Okay. So POTS is Postural Orthostatic Tachycardia syndrome. So that's an outlier, right? But we see it quite often. It occurs in age 12 to 50. Female to male ratio is 5 to 1. It's common after stress, such as fever, sepsis, which is blood infection, pregnancy, surgery, and trauma. So here's a patient with POTS. So postural orthostatic tachycardia syndrome, the symptoms are lightheadedness, fatigue, sweating, tremor, anxiety, palpitations, near syncope on standing, which means fainting or fainting, completely fainting, a heart rate greater than 120 on standing, or an increase of the heart rate of greater than 30 after 10 minutes. And that's how we diagnose POTS, although there's another test which I'll review later. This is a mycotoxin test on a teenager who presented with very severe fatigue, decreased appetite, and weight loss. And he was so fatigued that he couldn't attend school. I did a mycotoxin test on him, and we tested for ochratoxin, aflatoxin, and trichothecene, which is black mold toxin. So the ochratoxin, it should be under 2, his was 3.76, so mildly elevated. Aflatoxin should be under 1, his was 9.23, so pretty elevated. And those two can be airborne or in food. Trichothecene, which is the black mold toxin, should be under 0.2. His was 33.38. He was very toxic. So what we did is, he was living in the basement, and they had the house tested. I also tested his brother and his mother, and they had nothing. So we assume he cannot clear these toxins, yet his brother and mother could, and although he was also getting a very toxic load living in the basement with these toxins present. We had to actually remove him from the house. He went and lived with his grandfather for several months, and in the meanwhile I gave him binding agents to lower the body burden of the toxins, and supplements to support the liver, which enabled him to get rid of these toxins. And I rechecked him later on. His levels were way down. They were negative for the aflo and trichothecene. They still had a little of the ochratoxin. He was feeling 100% better, and he went back to school, although he missed a year of school. So with fatigue, the assessment includes evaluating sleep. We can do a home sleep study test called a watch pad. If we're looking at digestion, we have 3 main tests for digestion, and one I didn't put up, which is a food allergy panel called an MRT. But the GI effects is a stool study that looks at the microbiome, all of your microorganisms in your digestive tract, and if you have parasites, overgrowth of bacteria, undergrowth of good bacteria, if you have enough pancreatic enzymes. It's very thorough. The organic acid test, the OATS test, tests for metabolites of yeast and bacteria in the gut. It's a urine test. If you have an overload of candida, that's yeast, that can make you feel fatigued. If you have an overload of a particular type of bacteria called C. difficile, a particular strain, it can produce a metabolite that's neurotoxic. So I've had patients that have had anxiety. I've found out they had the C. difficile metabolite, treated them with an antibiotic, and their anxiety went away. Blood work includes CBC, so these are some of the common blood samples that you would get. The CBC looking for anemia, looking at white blood cell count, metabolic panel looking at liver, kidneys, electrolytes, glucose, the Lyme titers and the co-infections, which I mentioned, the Epstein-Barr virus, the HHV6, which I mentioned with the Montoya protocol. We look at hormones. So just to mention, we know in women in menopause, they have their estrogens and progesterone and testosterone drop down, and of course this can affect sleep. So looking at their hormone levels and seeing where they are as far as in perimenopause, menopause. But in addition, men can have fatigue and low endurance from low testosterone. So checking male for testosterone is important, and as well as looking at thyroid, which we talked about. There's also a genetic test called MTHFR. This is an enzyme that has to do with methylation of folic acid. Why is that important? Because we need methylfolate to make serotonin. So if we have a genetic blockage of this enzyme, then this can lead to a deficiency of methylfolate and therefore a deficiency of serotonin. In fact, a lot of psychiatrists will just add methylfolate to their treatment of serotonin uptake inhibitors for depression if someone is not responding. But we can actually check this MTHFR genetic test. We talked about the adrenal stress index cortisol saliva test. There's a test also we can do it's called Millennium. It tells us how you are metabolizing certain drugs. Are you a fast metabolizer? Are you a slow metabolizer? For example, so it mostly measures pain medications, antidepressants, and a few more of those types of medication. So for example, if you are a slow metabolizer of Valium, and we saw the half-life of Valium, you may be one of those people that at 5 days still has half the Valium in you, have the half-life. Or if you are a rapid metabolizer of your antidepressant, then you may need a higher dose. So this test can actually determine how you're metabolizing those drugs. Mycotoxins, we talked about testing. We can test for those mold toxins. Heavy metals, we use a chelating agent to measure the heavy metals, so that's something we can do. The tilt table test is for POTS, so we don't do it, but some of the cardiologists will do it, where they'll actually strap the patient to a table lying down and then tilt it up until they pass out, which is not very comfortable, but it's not fun at all, so I've heard. So the treatment, of course, if we determine that there's sleep apnea, then a CPAP machine or a dental device to open up the airway, or there's something called ProVent, which can open up the nasal passages. That may be appropriate. If it's insomnia, the CBT, the cognitive behavior therapy, may be appropriate for insomnia. Digestion, if we determine that there's an overgrowth of bacteria, the antibiotics are used, the anti-candida for the yeast overgrowth. Probiotics and prebiotics, very important to repopulate the good bacteria. There's a ton of research about the importance of the microbiome, the microorganisms and their DNA in your digestive tract and how they relate to disease, and there's a lot of research that's going to be coming out about that. We eliminate the foods that are causing inflammation in the gut. If there's Lyme disease, of course, we treat for the Lyme. We treat the Epstein-Barr and HHV6 with the Montoya protocol, if appropriate. We need to treat the thyroid. As I mentioned, I like to use the porcine thyroid, adrenal glands, There are supplements that can help support the adrenals, but also just really working on stress reduction is extremely important. Hormone replacement, either for women or men, using estrogen, testosterone, progesterone, et cetera. We want to eliminate the toxins. If there is, of course, heavy metals, we can do a chelation protocol. We have a protocol that's about 3 months. But it's a very safe protocol. We've had, our patients have tolerated it quite well. The detox, the biotoxins, if we determine that there's mycotoxins, we use binding agents and supplements to support the liver, as I mentioned. Of course, meditation, yoga, exercise, very crucial in treatment to help to stimulate the parasympathetic nervous system. And for POTS, postural orthostatic tachycardia syndrome, we have these individuals increase their fluids, increase their salt intake, medications that will enable the kidney to hold on to sodium. Also, some medications that will cause vasoconstriction so that they can maintain their blood pressure and their heart, their circulation. And exercise, well, coming back to medication, so also for POTS, SSRIs, serotonin uptake inhibitors, and SNRIs, which are serotonin and norepinephrine uptake inhibitors, have been quite helpful in POTS, not for the antidepressant effect, but it's just been useful in actually improving their function. And exercise as well is very important. So I just want to mention fatigue in cancer patients and post-chemo, because that's a big deal. We hear about it all the time. And this chart kind of covers a lot of what we've talked about. So even with, for working up cancer patients, we kind of go through the same scenario, the same with post-chemo. So the last thing I want to review is something called the governing brain, which I thought was kind of interesting. So this was, so for years, many years, exercise physiologists have been studying fatigue in athletes. What is fatigue? And what we found is that what we believe happens, and this is probably everyone believes this, that when the heart can't pump any more oxygen to the muscles produce lactic acid, and that's what happens when when the end point of exhaustion that occurs, right? But this is actually not true. What they found with athletes is when the end point of exhaustion occurs, less than 50% of the muscle fibers have been recruited. So fatigue is thought to be a safety valve to protect us from injury, but there's a gap there. So fatigue occurs, at least in exercise physiology, before injury occurs in most instances. So this is a very busy slide, but I just want to point out a few things. What is the relationship between the brain and exercise? So there are centrally acting performance modifiers, and this coaching and trainers use, of course, centrally acting modifiers. So things that will change in your activity in exercise are level of motivation, monetary rewards, of course, we know about that in professional sports, presence of competitors. So if other competitors can either motivate you or they can inhibit you. Knowledge of endpoint. If you didn't know where the finish line was, how tired would you be? Also, centrally acting drugs like amphetamines and caffeine can decrease your fatigue. And then we have visual feedback. So if you use visual feedback, and music can actually motivate you and decrease your perception of fatigue. And then the end spurt. We know about in a race that the final sprint, that someone finds that motivation to do that final sprint. So the question is, how does this relate to fatigue in general? Well, Dr. Rick Hansen, who wrote Buddha's Brain and Hardwiring for Happiness, he talks about neuroplasticity and about compassion and loving kindness meditation, how that can change the mind to change the brain to change the mind. So if we kind of really sink in some of these words and thoughts like delightful, tenacious, energetic, vigor, love, exuberance, joy, amazing, energetic, strength, power, can we actually change the feeling of fatigue to feeling fabulous? Thank you.